I'm your host, Dr. Lorena Ryder. I am a licensed naturopathic physician. Thank you for joining me today. Normally I have a co-host, Dr. Stephen Katz, but I'm flying solo today. Dr. Katz is on a well-deserved vacation. Our radio broadcast is here to help you navigate your journey to wellness. We try to make it simple for you without confusing medical terminology. We give you practical solutions to your health issues that allow your body's healing systems to do the work for you. It's simple, it's natural, and it works. If you're struggling with your health, come see us at Naturopathic Physicians Group to help get your life back. Now, a common question that people have for us is, what is a naturopathic doctor anyway? So let's talk about that for a bit. A naturopathic doctor can provide primary care and specialized care for you depending on their focus. We take a look at the body as a whole and we determine the root cause of your symptoms. We treat the cause rather than just treating your symptoms. We do spend an entire hour with you taking a full intake, asking you thorough questions. Many of my patients will say, well, I've never been asked that question before. And they really aren't strange questions. It involves things like, how much water do you drink? How many times are you having a bowel movement? How's your stress level? We also believe prevention is the best form of cure. Naturopathic doctors love to teach our patients how to care for themselves moving forward in order for you to live your best life. Quality of life is extremely important, right? This week, we're talking about IV therapy and its role in immune support and general overall body-wide health. I'll be listing most of our IV types that we have available, what they're primarily for, and how they can help you get healthier. Some people are uneasy when it comes to needles. You can't really do an IV without a needle in your body somewhere. So there's that. But most people find the benefits of the IVs to outweigh their dislike of the needle. So that's a win. So we offer many IV therapies. Some are individualized to your specific needs, but most commonly, and I'll give you this list, but it's not an exclusive list, but most commonly we do a nutrient IV, which is also called a Myers cocktail. And typically we will add an antioxidant called glutathione to the end of that IV. We do ozone, which you may have heard of, also called autohemotherapy IV. We have alpha lipoic acid available. We also do heavy metal IV chelation. Now, prior to doing that IV, you would want to do a heavy metal IV challenge test to make sure that you actually have heavy metals in there before we start chelating. We do a hydrogen peroxide IV. We'll do iron replacement therapy IV, and there's a really great neurological therapy IV that we have. And like I said, the others that we offer would be individualized and custom made for your condition. Now, later on in today's show, we have a guest joining us. He'll be here to share his experience in our office with IV therapy, and I'll get to ask him fun questions that you might all be wondering about. But let's talk a little bit about what to know and do prior to starting IV therapy. I'll talk about which testing would be necessary before having an IV a little later on, but for now, I'll just discuss the basic expectations. Even though you'll be receiving fluid, it's still important to be hydrated when you arrive for your IV. And trust me, it's better for both of us if you're well hydrated. It's just simply easier needle administration. It's a good idea to have something in your stomach prior to IV therapy. Some patients report nausea during IVs if they have an empty stomach. So just a heads up on that one. Also, just be prepared that your IV might go quicker or slower than the estimated time given. A typical IV takes about 1 hour. Sometimes, it's 45 minutes. Sometimes it's an hour and a half, but it's always a good idea to give yourself some extra time. I wouldn't schedule an appointment immediately afterward, just in case you have a slow drip that day, and it happens. If your body's a little dehydrated, it tends to be a slower process. Other factors to consider might be the vein size that we access that day, the needle size, the position of your arm, and many other factors. So, are there any side effects of IV therapy? Not many, actually. There are side effects to everything, right? You might experience some discomfort where the needle IV was administered. You could possibly bruise at the site of entry as well. And sometimes, like I mentioned earlier, there's a chance of getting nauseous during an IV, and there's a rare possibility of an allergic reaction, but that's extremely rare. So why might you get some IV therapy? Why not just take some supplements? Because why would you go for the needle instead? Well, IV therapy is the fastest and most effective way for your body to receive nutrients. It's delivered directly to your brain, your heart, other vital organs throughout the bloodstream. It is increased absorption as compared to the oral supplementation. Some people have digestive issues and they just don't absorb as well as they should. So while we're working on those things, the IV therapy is always a really great idea. IV therapy also speeds up healing for both acute and chronic conditions. Sometimes somebody will come in prior to or after or both of a surgical procedure and get some vitamin C IV just because it speeds up that healing process. And that way they're not down for longer than they expect to be. If for an acute condition, you might expect to do maybe 1 to 3 IVs. For a chronic condition, that varies your treatment plan. It could be many weeks. It could be a couple of months. It really just depends on what condition we're treating at that point in time. And just so you know, we do offer discounted packages at Naturopathic Physicians Group if you buy more than one IV at a time. So that's a bonus there. And we can combine therapies too. So if you have a condition where you think you need both ozone and nutrient IV, then we can do those two at the same time. And that's just an extra benefit of using both of those therapies to treat your condition. We can do, like I mentioned before, the vitamin C with glutathione, and that just gives an extra antioxidant benefit to that nutrient IV. The hydrogen peroxide and ozone therapy really don't go together because they basically do the same mechanism of action inside the body. So there are different reasons to do different IVs, but hydrogen peroxide might be good for somebody who just doesn't wish to get their blood drawn and they'd just rather get the IV instead. Today's topic, IV therapy and your immune health. Do you feel sluggish? Are you having a hard time bouncing back from surgery or an illness? You might be fighting a chronic illness, bacteria, or even have a reactivation of an old virus. Perhaps you just don't like taking supplements every day and want a quick and easy way to get all of those vitamins and nutrients into your system. IV therapy can be for preventative and also for maintenance health as well. At Naturopathic Physicians Group, our IV therapy is offered in-house. We don't do remote IVs. Our patients consist of regulars who we see on a routine basis, and we also have the patients who stop in once in a while when they need a pick-me-up. So I like to talk about traditional treatments in comparison with naturopathic treatments. And so let's do a little bit of that comparison here with IV therapy. So there's really only one IV treatment to compare when it comes to traditional treatments, and that's the hydration IV. It's typically used in a medical setting when somebody is severely dehydrated. It consists of a saline solution with no added components, pretty much just saline. And then sometimes there's an IV called a lactated ringer that's used, and that's a saline solution plus electrolytes. And these are the typical IVs that are in hospital settings if someone is getting a surgery or has come in dehydrated. And so that's used to replenish or maintain your current fluid levels. Dehydration just means that you've lost more fluid than you've taken in. This can come from being out in the hot sun, sweating, exercise, sports, even extended periods of diarrhea or vomiting, or simply just not drinking enough water. I suppose we could consider products like Pedialyte and electrolyte drinks such as Gatorade as traditional treatments for rehydration. And they work, they're just not as fast acting as an IV. And so let's compare that then to the naturopathic way that we administer the IVs. And we like to do some testing before initiating IV therapy. Sometimes specialty labs are needed. It depends on your particular medical history and your current medical status. We need to verify that your kidneys are functioning properly before administering an IV. That's pretty standard. We're adding extra fluid to your system. So we need to ensure that your kidneys are capable of managing that excess fluid. A simple blood test can show us your kidney function. Or if you have recent labs from within a year, that includes a CMP, which is a comprehensive metabolic panel, we can go by that as well. That's pretty standard. That'll tell us where your kidney function is. As far as naturopathic testing for IV therapy, it depends on the condition being treated. For example, if you are anemic and you need iron as an iron infusion, at minimum, we would check your red blood cells, hemoglobin, hematocrit, iron percent saturation, your binding capacity, and your ferritin. Your ferritin is your iron storage marker. It seems to be so rarely checked in traditional medicine, but it's so important. I really don't understand why iron and ferritin are not routine labs run, especially in menstruating women. Anyway, if someone is losing blood every month, that'd be a reasonable test order, right? Yeah. So next segment, we'll have a guest on the show. He's a patient of Naturopathic Physicians Group. He'll be sharing his experience that he's had with IV therapy. Perhaps he'll be able to put some minds at ease when it comes to being fearful of IVs. And also he can weigh in on how he feels after receiving IV therapy. So earlier I got a little bit into the different IVs that we offer. So I'd like to continue on in that conversation there and just talk about those in detail. So I had mentioned the Myers cocktail. That's the most popular IV therapy that we have. It provides essential nutrients. It boosts your immune system. There's magnesium in the Myers cocktail, and it dilates small capillaries and helps deliver those nutrients to the areas that have poor circulation. Most people report that it improves energy, helps with metabolism and immune functions, and it's a great anti-inflammatory IV. The conditions that we use to treat with the Myers cocktail include cold and flu and fatigue. If you have autoimmune disease, patients have reported some success with the Myers cocktail. Allergies, even chronic infections and illness, headaches, migraines, nutritional deficiencies. And this takes the standard 45 minutes to an hour to administer. So there's just really great vitamins in it: vitamin C, B vitamins, magnesium, selenium, zinc. And then at the end of the Myers cocktail, we typically administer the glutathione, which is a really great antioxidant. We also offer hydrogen peroxide IVs, and it takes maybe a little longer to do that one. I would count on an hour and a half. So it stimulates using the reactive oxygen atoms and enhances liver metabolism, promotes detox. A lot of us need some help with detox. It also helps improve microcirculation and infections and so on and so forth. The conditions that we use to treat, typically cardiovascular disease, neurological conditions, some allergies, asthma, if you have respiratory illness, any autoimmune conditions, and chronic and acute conditions. Now that's similar to the mechanism that ozone therapy, IV therapy does, but I'll talk about that a little bit later on. The iron IV therapy that we use, that's just basically what it sounds like. It's just providing iron to your body. Anemia seems to be a big problem with child age-bearing women, and so we'll just dilute the iron in saline, and that's a long IV. That's about a 3-hour IV. So that one you'll want to plan, bring a blanket, bring some water, maybe some lunch, and just hang out for a while. I had mentioned a neurological therapy IV, and that's similar to a Myers cocktail. It just has a little bit different ratio of some vitamins in it. Increased B vitamins is something there, and we add some folic acid. We have a higher level of magnesium and zinc in that as well. And so what that really does is optimizes your brain neurotransmitter function. It also increases energy, and it improves the cognitive support, those cofactors that we need for our brain to work better. And that's about a 45-minute to an hour IV. And this neurological therapy, it also treats substance abuse, or if you're having a hard time stopping the drinking. I know COVID has pushed a lot of people into, well, maybe pushed is a strong word. It has allowed the ease of drinking alcohol on a regular basis. And you might be having a hard time coming down off of that now that we're getting back to normal life. And I'm using air quotes right there. But the neurological therapy is also really good for any type of neurological disease. If you're having some brain fog, fatigue, even Alzheimer's, Parkinson's, some anxiety, insomnia, depression. For your brain neurotransmitters to work properly, they have chemical reactions that depend on these cofactors. So, for instance, for your GABA to turn into glutamate, to continue on that practice, you need B6. And there's so many things, like for your dopamine, your tyrosine, serotonin, melatonin, all of those neurotransmitters need B vitamins. Some need magnesium, vitamin C, iron, zinc, calcium. That's what we're providing. And like I said before, instead of waiting for the body to process that for you in case you have some digestive issues, then it just goes directly into the bloodstream, directly into the brain, and does that work already for you. So you don't even have to think about it. You just have to show up, relax, and let the rest to us. So I mentioned an alpha lipoic acid IV, and that also takes about an hour, maybe a little longer, hour and a half tops. But that's in 3 small bags, and we switch those out for you. Still just 1 needle stick. No worries about that. Alpha lipoic acid treats heart disease and also can help with Alzheimer's, diabetes, and neuralgia, so nerve pain, any type of nerve issues that you might be having, and any chronic conditions. And we would be able to decide for you which of these IVs would be best for your condition. Alpha lipoic acid also is really great for metabolism as well, just like the Myers cocktail does. It improves antioxidant production, protects and repairs the brain and nerve tissue. It improves nerve damage through injury of diabetes. It helps the immune system. It even lowers your blood sugar. So that being said, it's a good idea to eat prior to having an alpha lipoic acid IV. I'm Dr. Lorena Ryder, licensed naturopathic physician, here without my co-host today, Dr. Stephen Katz. He's having a grand old time on a well-deserved vacation. Today I'm talking about IV therapy and how they can help rejuvenate you, get your energy back, and fight off what ails you. If your doctor has told you that your symptoms are all in your head, or your labs say that your hormones or all of your levels of your kidneys and liver and red blood cells are fine, but you just don't feel fine, then come see us at Naturopathic Physicians Group. Our testing and treatments can get you feeling yourself again, feeling younger, more energy, improved brain function, the way that your body is intended to serve you. We chose Mission Impossible song for this segment because we like to take what seems impossible and make it possible. Today's topic of the day is IV therapy. And the reasons why you might need IV therapy or how it might help you is if you're experiencing fatigue, weight gain, early aging, brain fog, if you're having addiction issues, have a chronic illness, or having nerve pain, and that's just to name a few. Now, on this segment, every week, I like to give a tip of the week, just a little tidbit of information that you can use for your own health improvement. And when it comes to IV therapy, this week's tip of the week might be a little tricky, though, because there really isn't anything that you can do at home that is like IV therapy. You can't orally take enough vitamins and supplements that would equal the concentration that's in an IV, but what I can tell you is that if you are a smoker or were a previous smoker, that you do need at least 35% more daily vitamin C than the average non-smoker. And the vitamin C is in one of our most popular IVs, the nutrient IV therapy, the Myers cocktail. The oxidation process of smoking just uses up so much of your antioxidant properties that more vitamin C is needed to combat that process. So my advice or tip of the week is to go get a Myers cocktail. If you are a smoker or have ever been a smoker, the main ingredient is that vitamin C. And I would do that on a regular basis until you can either kick the habit or you're feeling good again if you've already kicked the habit. And good for you if that's the case. The treatment options that we offer at our office are the Myers cocktail, like I said, ozone IV, hydrogen peroxide, alpha lipoic acid, iron IV, neurological IV, and many other individualized custom-made IVs for your condition. So earlier I had said we'll be having a guest on the show. It's time to meet our guest, Mr. Josh Wolf. He's from rural Pennsylvania town, very far from home. So how's it going, Josh?
It's going good. It's hot.
Yeah, that's quite the difference from Pennsylvania. So Josh is 46 years old. He's happy, he's healthy, and he's loving life. But that wasn't always the case, was it, Josh?
No, not at all. When did I first come and see you?
It was probably about a month and a half ago, or maybe 2 months ago. I don't remember.
Well, I was here for about a month and a half, and then I was home for a month. So I guess 2.5 months ago was when I started.
Yeah, so Josh came to me as a patient with health issues that were greatly affecting his life. He was diagnosed with cancer and was intermittently receiving standard of care oncology treatments, but they were leaving him feeling depleted. Now, Josh, I remember your first appointment. You were really nervous. He was so nervous, I felt bad for him. Can you tell our listeners your immediate health issues and what you needed addressing right away whenever you came to see me?
About a month before I came to see Dr. Ryder, I had received actually it was about 2 months before I came to see her, I'd received what would turn out to be my last regular treatment, which is a triple targeted chemo immunotherapy treatment. And it started to attack my organs at that time, and I was given a choice to either continue with those treatments and continue to be sick, and they would monitor me as best they could. But it eventually put me in the ICU, and I lost about 50 pounds. The major issue was colitis and just overall basic cancer pain, they called it. So I came to her about 50 pounds under what my normal weight was, and just exhausted and very sick and basically out of options.
So, Josh, how did the colitis was the biggest deal for you at that point in time? So how was that? Maybe explain what it is and how it affected your life.
This could be fun. Basically, it's, as far as it's been explained to me, is an inflammation of like the intestinal stuff down there.
Yeah,
I am not a doctor.
Colitis is your colon inflamed.
Yeah.
So that's the root of the word there.
Yeah, what it did to me is my poor mother watched me get off the couch 15 times a day to use the restroom. But I wasn't able to eat or drink either, so I don't know where everything was coming from, but it was just constant, excruciating diarrhea. That's
Yeah, so you had a hard time leaving the house because of it.
I couldn't leave the house, no. At the end, I didn't leave the house. I couldn't go up the stairs. I was so weak, and just my organs were basically starting to shut down because of the lack of vitamins, electrolytes, everything. I was just so super low and everything.
Yeah. And so how did that affect your plane ride on the way out? 'Cause that's a long plane ride.
It was terrifying.
Yeah.
It was terrifying. I didn't know how I was going to be during the plane ride and how many times I was going to have to get up and make people get out of my way and go to the restroom, and how it could affect people sitting near the restroom for the duration of the flight. It was awful.
Mm-hmm. Yeah. I'm sure embarrassing too, right?
Yeah, it was very embarrassing.
Yeah, I can imagine. Okay. So that was our number one targeted condition for you, because we needed to get you feeling better, and we needed to get you to the point where you could live your life without being 30 seconds from a bathroom all the time, right? So
Yes.
Do you remember what we did?
I do. We started with the IV treatments and the blood ozones, and you gave me a GI Renew powder, which I did with a shake 3 times a day.
What did we do with your diet?
Dairy-free.
He's smiling, just so you know.
Dairy-free, gluten-free, sugar-free, and it's not that bad once you get used to it.
You took the news pretty well whenever I was telling you these are the foods that cause inflammation. And so you've got a severely inflamed colon. So let's take away the foods that are known to cause inflammation. And you were on board. I have to hand it to you. You did a really great job saying, all right, let's do this. But how difficult was it?
It was difficult. It's still difficult, especially the sugar. I'm one of those guys that right before bed like to have like a bowl of ice cream or some cereal. But once you get past I guess it's withdrawal from sugar and the craving, it's not that bad at all.
Yeah, I remember you telling me what you ate before bed, and I was writing it in your chart, and it was a cherry pie and a cup of milk and maybe a side of ice cream. Is that right?
Yes.
Something like that?
You just made me very hungry.
I said, okay, we're going to have to change that. And then I was getting pictures of Josh's dinner for the next month, and he was doing such a good job changing everything about how he was eating. Yeah, he was sending me pictures of whole foods and no sugar. And you had a lot of questions because when you're used to eating one way and then you completely change everything, there's a lot of questions involved there.
Yes, definitely. There were tons of questions, and it's gotten a lot easier. The gluten-free section in most of the grocery stores now is very helpful, so I just go there.
That's right. Yeah, the grocery stores do a great job with that. If you feel like you just haven't gotten to the bottom of your medical problem with your doctors and are tired of feeling tired, call the Naturopathic Physicians Group. I'm Dr. Lorena Ryder. Normally I have co-host Dr. Stephen Katz with me, but he's on vacation. So you've got me and our guest today. Topic of the day today is IV therapy. We talked briefly earlier about testing that should be done prior to an IV and how a naturopathic doctor does full intake to determine your cause of your symptoms and so on and so forth, and what IVs we offer. If you like what you've heard so far and you've decided that you'd like to try IV therapy as your treatment, we'll talk to our guest a little bit more about what that looks like. We have Josh Wolf here today from Pennsylvania. He's a patient at Naturopathic Physicians Group who receives IV treatments. Josh, can you tell us about the process of getting an IV?
I wasn't a huge fan of needles, but over the last 2 years, I've become used to it, and it's not bad at all. I come into the office, and Dr. Ryder finds a vein that's ready to go, and I get hooked up and sit back and relax and watch something on my phone or read a book or do whatever I want to do for anywhere from my longest one is usually about 3 or 4 hours. But it's pretty relaxing, actually.
Oh, good to hear that. Thank you for that. So what would you consider has been the best and worst part about it that you think our listeners might be wondering and would like to know?
The worst part of it is obviously the initial getting poked in the vein, but that's it, and it lasts not even a second, so it's not bad at all. And it's completely changed my life. I remember starting to get energy back while I was here, and I specifically remember going home and that just building when I got home, and just went out one day and mowed my mother's yard, and when I was done, I just was like, oh my God, I just mowed the lawn. Couldn't walk up the steps a month and a half ago. And I contacted Dr. Ryder and I said, I have this energy, it's crazy. And at first it was like I just couldn't stop doing stuff, but then I was like, I just wasn't used to this because it was just my normal energy, but I hadn't had it in over 2 years. So to get it back was just amazing, and to have it back right now is just a blessing. It's amazing to feel how I feel, have the energy I feel, considering everything I went through. Like I wouldn't have thought it possible.
Yeah, so many of you might be wondering, why did Josh come so far from home to get some IV therapy and to get naturopathic care? And that's because naturopathic care is different in each state. So we have licensed and unlicensed states, and then the scope of practice is different in each state as well. So sometimes people just need to travel for what they feel that their body needs at the time. And we're doing adjunct standard of care, cancer care treatment here for Josh. So he was on his off time, and we were dealing with the effects of what he had been treated with and what he was left with. So you gave us your best and worst, you think. Have you had any reactions, positive or negative, to the therapy?
I think I went over all the positive, just the energy and everything like that. I've had no negative reactions at all that I can think of. I was so super concerned about that. I made her start like slower than she wanted to with the amount and size of some of the treatments and things like that. But now I do the full 4 hour big bag of the poly MVA, I think it's called, and it's just amazing. There's no negative side effects, and I feel absolutely amazing.
Yeah, so we did some custom IVs for Josh. He did the ozone therapy. He also did the vitamin C IV therapy to begin with. We did have to do some specialty testing on Josh to get some levels to make sure that his body could effectively handle the IVs. And he was so nervous when he came in. And we like to make sure that our patients feel very comfortable with what they're getting done. So I didn't do anything that Josh was not on board with. And so I made sure that I educated him. I hope I did a good job, Josh, that I educate you on what we were doing and let you be in charge. Don't hold back. You can.
No, you did a great job. I knew you wanted to go faster at the beginning, and I knew you wanted me to get better, but you did an amazing job at listening to me and caring about how I felt about everything and doing it the way I wanted to start. And then I remember the one day I just gave you the green light and your eyes lit up and you went to town.
So you did have a small setback during that treatment. I think it was the middle of the treatment. Your colitis had a flare and you were concerned about, you were like, is it the treatments? I don't think it's a treatment. I'm pretty sure it's that spicy gumbo that you had. Do you remember the spicy gumbo?
Yeah, and it's been confirmed that was the issue. I did some retesting on that. And I didn't tell you about that.
Good to know.
But yeah, there's just some certain things that I need to stay away from. Super spicy food is not good with colitis.
Well, and I think
surprise,
that might go with anybody,
yeah,
right?
Yeah, but the thing was, when you read about flare-ups with colitis and everything like that, it talks about how long they can last and sometimes permanently with people. And I just continued with like the GI Renew powder and my treatments here, and it was just like any stomach bug. It was a couple days and I was back in the office and everything was great, and I haven't had any issues like that since. And I was told at my regular oncologist that the colitis was permanent. So
yeah, I think I said, well, let's see.
Yeah. So yeah, it's just my mind's been blown with everything, and just it's been a blessing to be able to come out here and do all this. And she spoke about when I started, she gave me some yoga stuff and a yoga mat and meditation and things like that are all involved with it. And I haven't really caught on to the yoga yet. I'm not very flexible. It's something that I aim to do as well.
Yeah, and that's okay, and that takes some time. But whenever we talk about treating the body as a whole, that's a perfect example of how that goes, because we addressed your food and your water intake, and what exactly you're putting into your body. Even the drinks. I know you came in with a bright red drink one day and asked me if that was okay, and what did I do? Look at the label and tear it apart?
Yeah.
Okay.
I didn't come in with the bright red drink anymore.
So, and rightfully so, but Josh was having some anxiety. And so I was trying to give him avenues to reduce that anxiety and reduce the stress and help him along as a whole person in this process. So instead of just, here's your IV, here, change your food, we really work with the whole mind, body, and spirit of getting you well. And I know when I could see it when Josh became comfortable, whenever he would come in for IVs, and we have reclining chairs, so they are comfortable. If you do have a long IV, you can just lay back and have your day. And you learned, though, over time that you should probably bring a snack on some days.
Yes, and I still forget my snacks. But no, I've 3 different oncologists' office in Pennsylvania and naturopathic physicians in Phoenix, Arizona, in Scottsdale, Arizona. Naturopathic Physicians gets the #1 rated chair, comfort-wise, for treatments. Definitely. Took lots of naps. You can nap, too, during your infusions, which is amazing.
Yeah, so there were a few times where Josh had a hard time keeping his arms straight, and we just have this nice cushy little strap that we put on there, and he fought it a little bit at the beginning, but realized it wasn't that bad.
She calls it a nice cushy little strap. It's like a machine that holds my arm straight.
It is not a machine. It's a brace that's padded with Velcro on it.
I used it twice and then opted out.
Well, and Josh, he's a pretty quick learner. So he was like, okay, I can't bend my arm.
Yeah.
That's all there was to it.
Yeah, so we done good. I think it was the napping part. Like when I nap and when I wake up, I like jerk around like a I don't know what, but I think a couple times I took a nap and woke up really quickly and startled myself and like jerked the IV out of my arm. But
yeah, and sometimes with those long IVs, you need a bathroom break, and sometimes if you move the wrong way or something, it moves, right?
Yeah, it came out a couple times when I went to the restroom, but especially when you're dumping all those fluids in there, you have to use the restroom. So,
right, but overall, it's not so bad.
no, not at all. I don't want to say I looked forward to it, but like it was nothing at the end. I just would go in and sit down and read and look at my phone or take a nap and get well.
Awesome, Josh. Well, we appreciate you coming on the show today and sharing your experience. I'm sure my patients will love your point of view and perspective from that.